We are Group 15 and our program is Saving Our Women Veterans. SOWV's goal is to reduce the number of homeless female veterans in San Diego County. To do this, we will provide the women with temporary housing, interview training, and assistance with job placement. In addition, these women will receive skills to cope on a personal level with issues like mental illness and substance abuse, because our primary health outcome is to improve the quality of life for these women. Our program is designed to answer the following questions. For univariate, we asked, does race influence the success rate of female veterans transitioning out of homelessness? And does age influence the success rate of female veterans transitioning out of homelessness? For our multivariate questions, we asked, can the risk of homelessness be predicted by the presence of MST, mental illness, and substance abuse? And can job training and placement, health and wellness, and temporary housing have an impact on preventing homelessness relapse? Our program will use the health belief model. This model fits best with our program because our participants will recognize that their mental and physical well-being is attributed to their risk of being homeless, hence perceived susceptibility. This model will also look at the perceived seriousness of mental illnesses and substance abuse, along with the threats associated if they do not seek help. These threats are continued homelessness, unemployment, and lack of supportive services. Acknowledging these risks will motivate them to change and ignite their self-efficacy, which will ultimately result in our participants becoming independent.
To measure SOWV's outcomes, we will start by administering a pre-test survey to collect demographic information on our program participants. In addition, 3 post-test surveys will be conducted. The first will be given the day before our participants leave in order to gain feedback on our program services and staff. Lastly, when we carry out our 2 home visits, we will administer a 6-month post-test survey and a 12-month post-test survey to check the status of our participants in regards to their employment and housing status. Moving on to our data analyses. Starting with our univariate analysis questions, first we asked, does race influence the success rate of female veterans transitioning out of homelessness? Based on the data we collected, we found that race does not play a significant factor in determining their success rate. This data was gathered from our pre-test and post-test surveys. For example, looking at the chart, you can see that out of the 10 white female veterans we had, only 7 were able to maintain a job and housing 12 months after leaving the program. But as you can see, this trend is similar across the race spectrum. Our second univariate analysis question is, does age influence the success rate of female veterans transitioning out of homelessness? According to the dataset, age does play a factor in the success rate of the female veterans. The data collected showed that women aged 35 to 44 actually benefit the most from the program, while the youngest and oldest age groups have a higher rate of relapse into homelessness. Moving on to our multivariate analysis questions. Our first question was, can the risk of homelessness be predicted by the presence of military sexual trauma, mental illness, and substance abuse? Based off the results from the pre-test survey, military sexual trauma significantly influences the chances of becoming homeless among the female veterans. And although mental illness and substance abuse are also predictors of homelessness, their influence is not as significant as MST. Our second multivariate analysis question is, can job training and placement, health and wellness, and temporary housing have an impact on preventing homelessness relapse? Based on the evidence from our 6-month and 12-month post-test surveys, temporary housing had the highest impact on protecting the women against homelessness, followed by health and wellness workshops, and then job training. Our limitations for this program were: number 1, having a reduced number of participants receiving assistance due to a limited budget, and this not only affects the number of individuals we are able to help, it also affects our findings. With a limited number of females, our sample does not effectively represent the female homeless veteran population within San Diego. Therefore, the findings we have can only be applied to our sample of 25 female veterans. Next limitation was a loss of follow-up, then self-reporting bias, and not having a comparison or control group.